Tim Kaine and Tom Kaine are taking aim at prescription drug vulnerabilities. Tuesday, the two filed the Protect Our Essential Medicines Act.
So if passed, the legislation would create a list of vital drugs made outside of the U.S. that could become vulnerable in the future. Emily Harrison explains how the proposal could impact us in Virginia.
As tensions continue to rise internationally, U.S. Senators Tim Kaine and Tom Kaine say they want to address certain vulnerabilities in the prescription drug supply chain. U.S. Senator Tim Kaine of Virginia says for those who live with chronic pain, their medications cannot become a bargaining chip.
We're going to start to identify which are critical drugs or drug components that we possibly need to be more focused on manufacturing in the United States.
In the newly filed 9-page bill, the legislation would require the U.S. Department of Health and Human Services to maintain a list of vital drugs, which could alert other authorities if a drug shortage is on the horizon. Senator Kaine says while the bill does not direct any domestic drug manufacturing, he hopes it could lead to it here in Virginia.
You know, we're conveniently located, we're near a port, we're near an international airport, other good transportation. I think Virginia is very well suited for an escalation of the American pharmaceutical industry.
The proposed legislation would also create a public list showing the top 3 countries which produce certain critical drugs. In many cases, this can include countries the U.S. has strained relations with, such as China. Senator Kaine says getting trusted access to these drugs is a key piece of national security.
We do have a specific directive to really focus on pharmaceuticals or precursors that are manufactured in China, because we think those might be among the most risky if we get into another pandemic.
Emily Harrison, 13 News Now.
Last month, Senators Kaine and Kaine also joined forces with Representative Abigail Spanberger to introduce the End Drug Shortages Act that would require drug manufacturers to notify the FDA if a surge of demand could lead to a specific drug shortage. Well, North Carolina Congressman Greg Murphy also urging action to be taken on abuses happening in the medical field. Murphy is pushing for the Lower Cost, More Transparency Act to be passed. He says this act will address how pharmacy benefit managers prioritize profits over patients. And he says the act would increase price transparency, lower prescription drug costs, and support patients.